Hi everyone, how are you? My name is Sarah Hunstead. I'm a pediatric nurse, mum of two, and I'm founder of CPR Kids. And I'm coming to you from Gadigal land today. And it is my absolute delight to say thank you to Mudge and Gal for hosting me again. I love being able to come to you guys every single week with a health or first aid topic to do with the kids, because it is the best thing knowing what to do to help them in an emergency. And I just love that. So if everybody could just give me a thumbs up or a wave just to tell me that all the technology is working as it should, that would be fantastic. And also in the comments below, if there's anybody who you think will benefit from this information, make sure you tag them down below as well, because that way, we get to share all of this. And today we are going to talk about head bumps. Now, this is something that happens to almost every child was almost a rite of passage of childhood. We want our kids to be out in nature, exploring everything, to be climbing trees, but sometimes they're going to get hurt. Sometimes they're going to fall off their bike. They're going to fall out of a tree. They're going to end up with a bump on their head. You know what? They might not even be climbing a tree. They might just be standing there and falling over, and they end up with a bump, because that's just what happens to some kids. So it's about knowing what to do. And most importantly, when it comes to the head bumps, it's about knowing the signs and the symptoms to look out for that show you that you need to take your child to get seen at the clinic, at the emergency department, whatever medical service is close to you. And so it's really cut and dried with head bumps, really, because to be honest, they're either okay or they're not. But I'm going to go through the signs and symptoms with you now, so that you know what to do. But first of all, really, it's about thinking, well, what's normal? What do we expect after our child bumps their head? Well, to be honest, we expect them to cry. Really, when our child cries with an injury or cries as soon as, they've hit their head, I feel some relief. Why? Because it means that they're conscious. So what we love, and I know that sounds terrible, but what we love is when a child whacks their head and they immediately cry. They scream. They want to scream the place down. Fantastic. That's good. Okay. When do we worry? If they have a loss of consciousness. Okay. Even a brief loss of consciousness, that is really, really worrying, and they need to go to hospital. Okay. So we expect them to cry, then they probably want to cuddle. So comfort them, give them a bit of a cuddle. If you want to, and they have a bump on their head that they're complaining is sore, and you know what I mean by that bump, call it an egg. It's that thing that looks like, you can see that swelling. It's a hematoma, so it's a collection of blood under there, and it ends up swelling. It looks like, half a hard-boiled egg, might have some bruising around it as well. Sometimes end up with a bit of graze on there too. And the one that is toddlers most of the time end up looking like they have this on their head, to be honest, don't they? So that's what we're looking at. You can, if you want to, put an ice pack on there. Make sure that it is wrapped in a tea towel or a face washer or something like that, because we don't want the ice pack directly on the skin. It might just help with the pain, okay? If they don't want it, don't worry about it. Don't worry about putting it on. You don't have to, okay? You may want to instead put a cool face washer. So a face washer that's, put it under the cold water, rinse it out, wring it out, and then pop it on. That can be soothing as well. But the aim of what we're doing here is simply to soothe their head bump. It's not going to do anything really with swelling or anything like that. It is just to purely help with their pain if their head is sore. But they might not want that. They might want to just get straight back into what they were doing, jump back on their bike again, and off they go, or keep playing or anything like that. And that is perfectly normal. So that's kind of what we expect with a head bump. So once again, I'll recap that they fall, they hit their head, they cry immediately, they need a bit of a cuddle, they might need a cold pack or something on there just to soothe it if they want to. They don't have to. And then they go back about their business like nothing has happened. Completely normal, playing normal behavior. And when I say normal behavior, I mean what's normal for them. Okay, so what's normal for them. and everything, they're just going about their business and everybody's sweet. Okay. However, if some of the things I'm about to talk about come up, you're going to probably need to take them either to a doctor or the emergency department or call an ambulance. And I'll talk about that now. So first of all, sometimes when kids bump their heads, instead of getting a big lump there, what can happen is the skin splits. And you notice that I keep referring to up here because this is one of the impact zones, particularly for toddlers, because toddlers' heads are massive. So they've got that nice big front of the head. They've got another impact zone around here under the chin, and they've also got a big back of the head. So often they can end up with cuts and bumps there too. So if instead of having that egg, they've ended up where the skin is split and they've got a great big cut on their head, so a cut or a laceration, then the first thing that we need to do is put something clean and dry over the top of that with firm pressure for a minimum of 5 minutes, probably 10 minutes. Okay. So, but a minimum of 5 minutes. So, if you've got a first aid kit, you can grab some gauze or something out of that. But really, often when our kid bumps their head, the first aid kit isn't necessarily close by. So, it might be grabbing a face washer, it might be grabbing a tea towel. If you're at the park, it might be using, something that you've got in your bag. It might be a spare t-shirt. It might just be their t-shirt. It might be their socks. So it's whatever you've got that's, reasonably clean and dry. And we are going to put firm pressure over the top. So I'm sitting here upstairs in my house and I'm looking around me to see, okay, what have I got? What I've got here is actually a fabric mask. So, because, I'm in lockdown where I am. So this mask is actually clean. It's fabric. I'm going to put that over the top of that laceration with firm pressure. Okay, so nice firm pressure. And what I'm not doing is kind of getting a massive towel and popping that over the top, because all that's going to do is kind of absorb the blood. We want that direct pressure. So nice directly over the top. So we're really honing that pressure down to try and stop that bleeding. So after 5 minutes, have a look. If it is still heavily bleeding, please put some more pressure on it and you're going to need to see a doctor. Okay. If that wound is large, so you look at it and you go like that, then you know what? Probably going to need some glue or some stitches. And remember, heads bleed and 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 bleed. So you may end up with a cut that's really, really tiny, but there's blood everywhere, and you take that off and you go, oh, that's okay. That's actually fine. But if it's that laceration that's either gaping, you can see fat or muscle or bone, you look at it and you go, then that's definitely an internal barometer that says you need to get it seen. If it's still continuing to bleed, and put firm pressure on it. And if it is a significant laceration, so I mean that, you're looking at it and it's quite bad, then please call an ambulance, because it's really impossible to stick a toddler in the back of the car and be able to maintain pressure while then safely getting to the hospital, unless you've got more than one person with you. But if it is having a significant amount of bleeding, or if it's a significant laceration, then, I can hear people going, well, what's significant? Trust me, you'll know. If you see that and you go, oh my gosh, trust me, you will know. Okay, you will. Then, of course, call an ambulance if it is significant. Now, off the topic of lacerations, even if your child does just have that egg on their head, that bump, or maybe there's nothing there at all, you can't see anything, maybe it's just a red mark or something like that, what are you going to do? Okay, so first of all, we want to look at them and see, are they showing any of the following signs and symptoms? And I want you to watch for these signs and symptoms for a good 48 hours afterwards, okay? Because sometimes when a child or a grown-up bumps their head, they can have symptoms that are delayed coming and presenting. So that's why, we've got to have our spidey sense out, be on the radar for if any of these signs are happening for 48 hours afterwards as well. So first of all, have they had a loss of consciousness? If they've been knocked out, even for a few seconds, that is a big impact in a child to have them knocked out. You need to call an ambulance, okay? That is a significant injury in a kid. to have a loss of consciousness, absolutely need to have an ambulance coming. Okay. So if they have a seizure after they've hit their head, they absolutely need to be in an ambulance going to hospital as well. Okay, really important, because that is a significant head bump if they are having it, if they've had a seizure. All right. So when else would you need to seek medical help? First of all, they have more than one vomit. So often kids will have a vomit if they get really upset. So if your child's crying and crying and crying, they work themselves up and they have a bit of a spew, okay, all right, that's okay. But if they have a vomit either that's delayed, so it's a little while later, or they have another vomit after that, or they, then that can be concerning. We can be worried about that. So they need to absolutely be seen. Okay. What else do we need to look out for? So in an older child, are they complaining of any visual disturbances? So are they complaining of blurred vision, that they're dizzy? Are they unsteady on their feet? Now, impossible to tell that in a baby. Yeah. Tricky to tell in a toddler. They can't, obviously, describe that to you really well. But you may notice that in a toddler who can't describe that they look like they're woozy, that they're rubbing their eyes. So it's their behavior that you'll see change. Okay. But an older kid may be able to articulate that to you. Or another thing to look out for is a headache that's not relieved by, just a bit of a cool pack or some simple analgesia like some Panadol, and they've still got a headache, then they need to be seen. Okay. And another really concerning sign is if they have blood or clear fluid coming out of their ears, that can indicate that they've got a significant injury, or if there is clear fluid or blood coming out of their nose as well. So I'm not talking that they've bumped their nose and they've just got a bit of a blood nose. I mean that they've hit their head and they do have this stuff coming out. That's an ambulance as well. So what else do we need to be concerned about? I think, to be honest, that the biggest one, apart from all of those other things, is a change in behavior. So are they drowsy and it's not their normal sleep time? How has their behavior changed? Are they normally cyclones where they're running around the house everywhere, but now they're just sitting on the couch and they're kind of just quiet? That's concerning. So how has their behavior changed? So that's one of those things that with head bumps, they're kind of either completely their normal behavior or they're not. And if they're not, then that's something that you need to go, okay, I want to get this checked out. I really want to get this checked out. And I guess another one of the things that we need to be thinking about too is that if your gut says that something's not right, got to trust your instinct. Yeah. If you go, oh, I'm unsure what to do, then I want you to take them to get seen. Okay. Really important. If you go, oh, I think they're okay, but there's something that's just telling me that something's not quite right here, then go and get them seen by a doctor just to make sure that they're okay. I think always just err on the side of caution and do that. Okay. I think it's an important thing. All right. But what I want you to do is bear with me for a sec while I just share my screen. Okay. So I'm going to share my screen here. I'll make that a bit bigger. There we go. So what I've got here is the fact sheet from the Sydney Children's Hospitals Network. And this has got a great acronym on it that is head bumps. So this is it here. And I'll put a link to it in the comments down below as well. Or you can just Google Sydney Children's Hospitals Network head bumps fact sheet. Okay. And it says, please take your child to the nearest emergency department if any of these things happen. So head bumps, H, worsening headache, seizure, or unconscious. Yeah. If they have any eye problems, so blurred double vision, anything like that, remember in the little ones, you may see them just continually rubbing their eyes, their behavior changes. An older kid will be able to articulate this to you. Any abnormal behavior changes, and if they have dizziness or persistent vomiting. Okay, so we talked about that. Balance, so you might notice that they're woozy or that they've got weakness or numbness in their legs, arms, hands, feet, and so on. If they're unsteady, if their speech is slurred, that they're having trouble with confusion. They might be, not talking right, things like that. You just go, no, that's not right. But of course, developmentally, is it different? Poor concentration, they're drowsy, they're sleepy, or something's not right. Okay, so please, and remember, seizure or unconscious, any of that bleeding that I talked about before, please call an ambulance. And that is a really important thing. So remember, this is the mild head injury fact sheet from the Sydney Children's Hospital Network. So I think this is a really good resource that we can use. And the other thing too is that Health Direct, you can go on their website or you can give them a call and they will ask you questions and talk you through where you need to go, whether you can just stay at home with your child and just watch them, or whether they need to go to the emergency department, whether you can just take them to the clinic. So those sorts of things. So Health Direct will talk you through where you need to go as well. And I think that's another great resource to help you make a decision about what's happening. Because sometimes if it's just mild, you might be going, oh, I don't quite know what to do. But they can be really, really helpful with that. So if anybody's got any questions, please just type them in the comments below now. But otherwise, I will put a link to this down below. And the other thing that I would love you to do, guys, is that I would love to keep doing these sessions. If there's anything that you would like me to talk about, can you put it in the comments below? And I will endeavour to bring you a session on that particular subject. Okay. So it doesn't look like we have any questions. So I will say see you later for today, and I will put that stuff in the comments below. Okay, I'll see you soon, everyone. Bye.